Is that pretty accurate?
Correct. Yeah. So I always, that's Mike knows his.
Nailed it. What's going on, podcasting world? Welcome back to another episode of the Core Consult RX podcast. Cole and I are joined by some guests today. Once again, first time on the show. We've been talking about having them on for like 17 months, I think, at least. Olivia, Lindsey, what's going on?
How we doing?
Hello.
Happy to be here.
So I'm going to let, obviously, Lindsey and Olivia's kind of talk about their Lowcountry hustle that we got going on, but I'm excited to have both of them on there because they have a company called Lowcountry Street Grocery, and one thing that we've talked, or I guess never talked about on the show, is like diet and nutrition and some of those counseling points. We
like to at the end say, oh yeah, and tell your patients to have good diet and need to exercise.
But then we give you no tools to use.
Zero tools.
So Olivia's here to rectify that. So Olivia is a dietitian, and so she's here to share some wisdom for us non-dietitians. She has a notebook and a pen with her already, so she's ready to go. She looks more prepared than Cole and I have ever looked in 112 episodes of doing this.
Which is really saying something. I mean, you're looking at like a yellow, wide-ruled notebook.
I didn't even know they made those anymore. That's great.
We got a whole stack of them.
Nice.
I'll bring you
nice.
some.
Lindsey, you got a notebook too, though. So
Mine's fancy. I got
legit.
dots.
His doesn't have lines though.
No lines.
Yours is
We got
more
like a Japanese manufacturer.
That is
pen.
interesting.
Yeah, it's frustrating.
I don't know why.
I can't do it without the lines.
So that's good. That's fair.
It is frustrating, actually.
So you guys are ready to kill it. So talk to me a little bit about Lowcountry Street Grocery. Like, how did that get? First of all, explain to everyone listening what that is first. Like, what do you guys do?
You want to take this?
I can. The general descriptor of Lowcountry Street Grocery is we are a social enterprise, meaning that we use traditional business tools to accomplish a social mission. And that mission is to provide equitable food access across the Charleston area. And so we have a lot of different avenues that we do that in, and it's shifted since COVID, of course. But the main focus is we buy from over 150 local producers, so farmers, makers, all of that stuff. We have a mobile farmers market on a bus, which was the origination of the whole business. But it's really stemmed from there. So anyway, we put all that onto a bus, which I always forget what year. Lindsey, what year is Nell?
She's a 1988 Ford B700.
Okay.
Yeah, you got it.
I know that part. So completely retrofitted Nell and took her all around the Charleston area. And so we used a sliding scale model depending where we were in the community. So some just farmers market prices and then dropped those prices when we went to places that had low food access. So that is where it started, and then it's really taken off. And now we're doing a whole delivery model, and we do GroceryRx, which is our food prescription program, which you will be hearing more about all of that here soon, I think.
Awesome.
So whose idea was it to actually turn it into a mobile and unit and get a bus and all that stuff?
That's pretty unique.
Yeah.
Lindsey, I'm looking at you. I feel like that's got you written all over it.
Not my brain.
That was me. So I worked with the state government in Hawaii a ways back and was tasked with doing something about the diabetes endemic in our district. So a lot of ideas kind of came across my desk, and I got out into the community and started working with different farmers and farmers markets and things like that, and kind of put two and two together with a few similar models there that I could bring back here in Charleston, where I've spent the last 20 years, and make that something sustainable, which is really, what's so important about what Olivia said, us being a social enterprise. It's vastly important to have a sustainable model, especially when you're dealing with food insecurity and food access, with our pillars being empowerment and education and those kinds of things, that we're not reliant on grants or donations. Yes, those are great and helpful if and when we can get them, but we wanted to create a model that works for itself and by itself. So the bus was the general idea was, let's get as much produce and healthy foods onto a mobile unit that can go into different communities and move around, especially thinking about folks without transportation, right? And being able to do so like on the fly. That's me snapping my fingers for all of you listening.
That's not even an added sound effect. That was
Right.
all natural.
Kind of strange how that worked out. But that was the idea, and it was crazy and weird, and everybody's like, you're insane. Don't quit your job to do this. Also, you should be a nonprofit. Also, why a school bus? Also, why an old school bus? And really what we wanted to do was kind of bring a very community-centric approach to where this bus was approachable by everyone, right? We're not like pigeonholing anyone or going after like a traditional business where you're just trying to pad the pockets of the investors. You know, you're like, where can I make the best buck and the most of it, the fastest, and move that way. We're also not just focusing on solely the mission, because, you know, we, in our own philosophy, which we can get into maybe a little bit later, you know, we kind of follow a different approach that is very much in line with toxic charity. If you're not familiar with that, it's just a whole thing. But basically, we're very intent on creating, you know, access and equity for everyone, and making it fair, right? We're just trying to create like a really equal, fair space. So the bus moves around, different, like Olivia was saying, different price points. It's old school. It's reminiscent of, you know, it's very nostalgic. So like you get your old farts. They're like, oh, I remember an old farm bus in my day and come around my neighborhood. You know, and you also got the kids, and you got the, it's just nice. And
What
it's
do the kids sound like?
Running down the street.
Soft
Give me an apple.
Yeah, wait, there's no ice cream on that. I'm out.
I'm out.
Peace. Yeah, so it's been a fun. Now it's been a long ride, but yeah, it's kind of, we pieced it all together ourselves. You know, we didn't really start with anything. Raised a lot of money on Kickstarter. That's where we got our.
When was the inception?
So 2015, I guess you can say. So that's when we put this on Kickstarter, raised some initial funding, and got everybody to support it. And then it kind of blew up that year a little bit. Everybody was like, holy crap, this is so cool. And we're like, oh, it's just a bus with a bunch of produce on it. We're going to do this thing. So the pressure was on, and, you know, we hit the ground running in 2017. And here we are. And we've diversified, and we've pivoted, and, you know, stayed true to the mission, and added elements to the mission, and added elements to the business. But we're still doing the same thing and focusing a little bit more on the nuances of the approach, I guess.
That's awesome. So where do you get your products from?
Oh, man. So right now, that's a big issue. We've actually, since COVID-19,
We're saying talk louder.
Oh, yes.
There you go.
There it is. I found the microphone. It's right here in front of me.
Oh, yeah.
Hold on.
The whole time.
Oh, boy. Hello.
Hello, listeners.
So, yeah, we source from about 200 different local farmers, partners. I mean, everything from like tortillas to bread. You know, so that was a big thing we wanted to work on years ago, was sourcing the best of the best of the area, and making sure that the best of the area was accessible to everyone, right? So that was one of the things. Like, you go to a farmer's market, you see the same people, you see the same faces, and they're usually in affluent neighborhoods, right? And that was what was so unfair to me here in Charleston, especially. I was like, why, working in the restaurant industry, am I seeing the best produce, the best stuff coming in and out of the doors every day, but it's being fed to tourists? What's up with that? Also, we have just up the road, children living further beneath the poverty line than anywhere else in the state. So big part of that was making that accessible, and working with so many people that we could, you know, anybody that we could possibly get on the bus, we were going to get them on the bus.
And right now we're in the winter of the Lowcountry, so there's nothing growing. I mean, not nothing, but very few. So reaching out a little bit further into South Carolina.
Yeah.
Which has
Yeah.
been Lindsey's day in and day out, is trying to find that stuff. And we don't talk about that part as much, actually. That, you know, for some nonprofits or businesses, their sole mission would be like the local food sourcing. And that's, you know, a part of it, but it's not even the whole picture. So it's pretty cool. I mean, really, really cool. And during the pandemic, it's really shown its true colors by being able to support our local food system. And that has like seriously boosted us, and our farmers were okay, and they were thriving during this and have been. And so it's been really cool to see that silver lining of it.
Yeah, which we didn't, you know, originally, I I guess we should say, we are a dual mission business, right? So the mission is, we have two missions. One is food access, food security. We just say food equity to cover all of the bases, really. The other part of that is supporting local farms. And so it's, I guess what we just try and do too much, to be honest. Like we do a little bit of everything. So we have this, I don't know. I mean, sometimes it's like we wear this shining armor and we're like, yeah, we do everything. We don't even have to say it. We don't even, but at the end of the day, it's like, holy crap, we got to slow it down, like put some more focus on each element of the business. But, the supporting local farmers, right? So, I mean, it's one thing to aggregate a bunch of, donated produce from like China, right? But we all know the value of that produce, and it's probably not going to be the greatest by the time it gets to us. And it's definitely not going to be the greatest by the time it gets to somebody that really needs it the most. It's also not supporting your community. And in times like this, where we have a pandemic and the logistics chains are all over the place, you've lost any of your connections that you're outsourcing. You have to rely on your local community, right? So this is something we've been focusing on for years, and connecting, the local farms, giving them another outlet, giving them their own grocery store, essentially. You can just kind of think about it that way. Like they're too small to get into Harris Teeter. They're too small to get into Whole Foods. But they're too big to spend all of their time on the farm and at markets. Right. And being that kind of intermediary and being that bridging the gap between the consumer and the farmer, and then widening that our footprint in consumers, right? And like bringing that to every consumer of Charleston is what it's all about. So at first, the pandemic was pretty scary. We had a lot of farmers. I'll never forget the moment. One of our egg farmers came into our office and he looked at me and he said, I think I'm out. I don't know what to do. And I was like, what are you talking about? He's like, I just lost all my accounts. He's like, because they sell to restaurants primarily, especially here in this tourist town that we love to live in. And I kind of looked at him and was like, well, what can we do? He's like, I don't know, but you're it. I was like, okay. And how much what's the percentage of sales that we're taking up for you? He's like 20%. And that day I heard it like 2 or 3 more times from different guys and gals. And I was like, all right, put the team together. You guys want to do this? We're going to do it.
It was a conscious decision. And how many dozen eggs do we buy a week?
I don't think I can say that.
You're at liberty to say.
Is it a lot of eggs?
But it's a lot of
eggs. We go through a lot of eggs.
We went from, it was a boon for everyone involved in the local food system. The first couple of weeks was very scary and nobody really knew what to do, but it reversed this ugly trend. I think Americans have been, going down this path for 50 years, 60 years now. And I think it's a big reason why we're all here, right? Is the processed foods and, seriously, but that's kind of where everybody's going back now to this very more simple approach and knowing where your food comes from and being invested in your community. And farmers markets are selling out. We're selling out. We had a waiting list at one point for 1,500 people on our we call it community supported grocery. So it's like a CSA plus. So if you're not familiar with the CSA model, it's basically a way to support local farms directly. And you give them a little bit of money each quarter or whatever, and they give you a bag of produce, and it's very seasonal. So we kind of took that idea a while back and added bread and milk and eggs and cheese and menus and made it really more approachable for everybody. But yeah, that's where all of our focus is now, and we're selling at least 1,000 dozen eggs a week now, which is
a
crazy.
lot of eggs.
Yeah,
that's awesome. I'm gonna have to put up some pictures of the bus like on Instagram for everybody else, because it like hearing about it, I don't think does it justice. I remember the first time like I walked into it, I was like, "Oh, junk! This is awesome." I mean, it literally it's super nice on the inside. It's very, very cool.
Yeah.
So yeah, I think I will definitely put up some pictures so you guys can actually see it if you're not in the Charleston area. But it's a very, very cool design. And part that stuck out to me, I think, is interesting. And I kind of picked up on this like when we first met, like a year ago, I guess. Was you said that everybody was kind of like, "Oh, well, that's a weird idea. Like you need to do this, the things that have been done 1,000 times." Mm-hmm. And I like that you were like, well, no, because I'm going to do this idea that's completely out of the box, and I think it's going to work. Like that's the stuff I always pick up on to where like as soon as and we'll talk about our, working together and stuff in a minute, but like as soon as I heard the idea of all this, I was like, that's an obvious no-brainer. Like that's obviously going to work. Let's do that. Even though like initially it was like slow getting off the ground and people were like, where's the profit margin in that? It's like, dude, you gotta look long term. Like, and I like that about y'all is because you kind of can see 4 plays down the road and not just what's right here in front of you and the way everybody else does it.
Right.
Because that's kind of like tired. Everybody else does it that way.
It's kind of not
fun in
working all
that.
the time.
Yeah.
And that I will say, the bus was never the end game too, and it was just kind of like that starting point, and then there's a lot more impact that you can do on top of that. Because, I mean, for true access all the time, you have to plant grocery stores in these neighborhoods where they don't have them, and that's not that bus can't accomplish that. So it's a starting point to a lot bigger web that we're working on and working to build.
Yeah, it's kind of like the breakthrough, and we knew that. I mean, you can't come out and say that when you're initiating the support, it's always been the bright shiny object to bring in something,
and it's awesome,
right? And it's so much fun, and we miss her so much. I don't know if we said this, but it is on pause right now. I think it is just in terms of everyone's safety.
It's a very narrow walking space down the middle of the bus, so it'd be one customer at a time.
Yeah.
So it will come back, and we will have markets again sometime.
You drive the bus, Lindsey?
I'm the only driver of the bus right now.
Nice.
Unfortunately, yes.
Which is also not sustainable.
Yes.
Well, speaking of that, I have 2 questions. So, mobile bus storefront, as far as you know, you're the only people who do anything remotely like that, or across the country there's other things? And 2, so you mentioned right now you're the only bus driver. Are there other employees, or is it mainly just the 2 of you? Is it a huge group?
Yeah, so we are one of many, actually. I actually went to a mobile market summit last year. There's
no way.
They have a mobile market summit?
Yes.
It's a market for everything.
It's awesome. Yes.
We need a summit.
What's different, what separates us from the pack is that we're the only social enterprise. So we're the only ones that, so the majority of the other mobile markets are nonprofits. And they're doing a great job, and there's nothing wrong with that at all. It's just an entirely different approach, and it's just the way that we approach the issues and the way that it's just I don't know, it's just remarkably different coming at it as a business, as a small business startup, and like hustling and growing white hairs in 3 years. Not to say that that's not the case on the other side, but like it's just a different hustle, right? And then the other side, and that was one of the things and one of the reasons that we chose that path. I did a lot of, I consulted with a lot of folks that had similar models and similar entities, and the number one takeaway for me was don't go the nonprofit route for this particular, for Charleston, for South Carolina, for the time period. But
for your situation.
For our situation, yeah. And being able to diversify and like having this, we had already had so many ideas lumped together, and this is like the future plan. This is what we want. And that's where it really got people like, what? This is already insane, but you want to do this and this and this. But yeah, the employees started out with, we had a good group of volunteers. We really did. It was just such a unique thing. I guess everybody just kind of coalesced around it real quick, and we had a lot of I had some friends working with me too. We actually learned the small farm economy. We farmed for 2 years, which is wild. So we tried to do that for a while. Man, do I have respect for the growers. Mm-hmm. It was awesome, but I learned more growing food and working with some school gardens than anything else in my life, probably. But we did that. We just wanted to hit on everything. Like, we want to know how to farm. We want to know how to sell it. We want to know how to store it. We want to know how, all of it. But yeah, we started with a few volunteers on the farm, hired a couple of folks in 2017 when the bus was about to, we put the bus together ourselves as far as we could. That was really important to us. And then hired a couple people. And we had like 2 or 3, 4 employees-ish for 2 years. I'm still waiting for my first paycheck.
Is it lost in the mail?
So yeah. Mm-hmm. But now we actually hired, since We hired somebody. We had our first full-time like salaried position hire last year, and since then we've hired about 6 more salary positions.
Wow.
And then I think our staff now payroll's like, we actually have a payroll. That's weird to say. Like we have like 25-ish full-time employees.
Oh wow! I didn't even realize it was that many people. That's
Yeah.
awesome.
That's
It's
literally
a semi-recent.
that literally just happened.
like the last 5 months.
It's a large small business.
It's a very
It's a-
weird.
It's a weird place.
Some people would call it a medium size.
You might,
but
almost a
Another
vente.
word.
define full time though. I mean, it is still,
Right.
and this is something I'm not kidding when I say that this literally just happened. So we're just now kind of like
Just breaking news on the podcast.
right.
It's just good.
You just hired 24 people.
right there.
On the way over.
I was
somebody on
wondering-
the. You see that person by the
I saw
phone?
you. I saw you texting during the.
Yeah,
I was
that was
wondering what
it.
you were doing, and now it makes sense.
Hired.
Just like that.
Hired.
Hired, just mass text. For some reason my phone didn't go off, which is interesting.
weird.
I guess I didn't make the cut. That's fine.
You're fired.
Great. I have to go back to being a stupid pharmacist again. No, that's really cool, man. I like that a lot.
Yeah.
And so, as far as going from the community to then looking at like health centers and things like that to kind of partner with, and then like doing patient education for patients who are, patients of the clinics and things like that. How did that has that been the plan from the beginning, or is that something that kind of just evolved as you started going? It's convenient you have a dietitian on staff.
Pretty convenient.
That's pretty sweet.
It was all a dream. I used to read Word Up. It was in the works, and it has been since actually the conception and thinking about this back in Hawaii. But where this came in, we didn't really know. We tried to squeeze it in before with the bus, and this is something that we've worked on for quite some time. Like we knew that there was a food prescription model, but where that fit in with us, especially being a business, right? That's the other tricky part. It was like, well, what are we going to do? How are we going to make this work sustainably? And for us in the mission side of everything that we do, it's like break even is fine, right? That's, we dedicate a certain portion of our business and sales and energy to the mission of what we want to do. And so with that, I don't know, it's like a few years ago, we kind of tinkered around with another couple of agencies in town about how to subsidize those costs and create a program and have Olivia come and teach a class. And it was, the hard part was like, how do we pull her away? How do we make this like a full-time job or even a part-time job so she can get paid, not because we want somebody to give us money, but because there are bills and things in life that you have to.
I feel like
right?
I feel pretty confident saying it's okay to want to get compensated.
Right.
I mean, I feel like your heart's in the right place, and it's okay to also be able to live as well.
Right. So
'Cause,
Need that.
yeah, but it took a lot. I mean, how many rounds have you done?
Well,
so
I guess
far?
we started with like a trial thing at Tri-County Family Ministries years ago, a few years ago. So more informal. And then, it was always kind of my idea is I wanted to coerce, my dream is to coerce insurance companies into paying for preventative medicine, to covering it more. And the way I see that is by like helping pay for nutritious food. It's such an important part of it. And so that was, definitely where I was coming from. And then, of course, because I'm a dietitian and then meeting someone with a bus that drives around fresh food, I was like, great, how can you put it together? And food prescription programs have been sort of taking off. Again, they all kind of vary in their own, like how they go about it. But we started a few years ago with some pilots and it worked. And then with Fetter, when we came to them, it was kind of the more like, all right, this is what we've learned. It's not completely panned out, but it works, so.
No,
So what does it look like, especially for someone who's never heard the term food RX before, which would be me. So how does it work, and how is it different than having like a dietitian in the clinic that you send your patients to see?
Yeah, so the way that we do it, like I said, there are a lot of healthcare clinics around the country that are now doing this, and they're fully established programs within their healthcare. And some of them have like pantries that they put on site that, it's just a matter of like, here's a $5 thing to go and spend at the pantry or whatever. I wanted to put more emphasis on the education part because it's not, obviously access is a big part of it. But if you don't have the education or the care, then it means not, and so I've seen plenty of people at some of the other places where we work, where they are giving out food and stuff like that, just taking that food, like a bag of sweet potatoes, and going to the garbage can and throwing it away. And that to me is just, there's a huge gap there, and it's not that person's fault, and it's not, everyone came with good intentions. It just hasn't, the missing link wasn't there, right? So that's where I wanted to put the education to play. So what we do, and kind of the overarching goal is to have, whether it be physicians or pharmacists or a nurse practitioner, whatever it might be, kind of refer them into this program. And so we had a weekly class, a nutrition class, and it went on a revolving basis. The idea was to do it for 8 weeks, but then we had some people just hang out for 16 weeks or whatever, which is great. So we do like labs at the beginning of class, and Mike would work with them to do like med recs and stuff like that and get them kind of all up to snuff, and they would see the physician and then start coming to class. And each week we would do a different topic, and then we would set up a market inside the clinic. And after class, they would get a $20 voucher to go shop at the market. And so even with that $20, it's also subsidized. So the amount of food that they're getting is significant. So that was kind of it. And so after, periodically we would do labs and check in with them. And then if one person needed a little bit more like one-on-one time, then either Mike would step in, or actually even the dietitian at Fetter too. So we all work together pretty closely, I would say, for that.
Yeah, my main role in the actual class was just to do the blood pressures. So I felt like I nailed it.
He did come in.
Nailed it.
Every week.
I was like, I got this. I can do this.
Yeah.
He slipped his monster behind his back.
I did.
and
I literally used to have to hide it because this is probably a bad example.
Yeah.
Even though honestly it's a can of vitamins, but then you get the sugar-free one. But that's fine.
Okay.
What you
That's
telling
what I've
yourself?
definitely heard from patients before too.
Okay.
The ones in denial. Yeah.
Yeah.
No, it's interesting too because you said the education piece, and I had an example of this actually happened to me this week already, where a patient's A1C was through the roof, and she was on Lantus. So I was like 60 units of Lantus. She's on Trulicity. She's on Jardiance. She's on Metformin. So 4 different meds, and her A1C is still in like the teens. And I'm like, what in the world? Like, because if my first thought is, coming from a medical standpoint, is like, oh, she's not picking up her meds, she's not taking them. She was. And I'm like, I even verified, so our pharmacy's filling them, and I'm like, crap, okay, that's not it. What in the world is going on? And then I started talking to her, and I was just like, okay, let's put all the medications aside, let's just talk about food. And like, we started talking, and just because, like you said, she'd never been educated on that level of as far as what to eat. She thought she was eating well, and then when the first thing she gave me example of was, okay, so start my morning, I have a couple bowls of Raisin Bran. I was like, oh no.
Oh gosh.
And like I showed her, like her breakfast was like 150, 160 grams of carbs just for breakfast, and then lunch was the same kind of thing. It was like she had no concept of like when she thought a carb was like sugar, like sweet sugar. She's like, wait, it's just 2 pieces of toast though. That's not sugar.
Right.
I didn't put any sugar on the toast.
Right.
I was like, ooh, okay.
And you'll hear similar stories about fruit juices and fruits and diabetes, and that's why,
especially with COVID, everyone's drinking orange juice right now because they need that vitamin C.
So the ADA recommends medical nutrition therapy for all patients. You know, we can tell them all we want about their drugs, but if there's not the health literacy about nutrition, then it's a gap.
And that's what I guess, something that's incredibly heartbreaking to me, because I also work at MUSC part-time. Most of the time right now I'm working full-time. So I'm doing completely remote outpatient, throw whatever. I'm the cleanup crew. So I literally take any disease state that doesn't fall under a specialty, which actually ends up being mostly diabetes, weight management, a lot of renal disease, whatever, GI disorders, whatever. One of the most heartbreaking things is when I get someone that has renal disease, possibly even like end-stage renal disease, and they tell me they've never met with a dietitian before. And it's like, what? And it doesn't even have to be a dietitian. It's just that emphasis on the nutrition part, because there's so much. They probably would have ended up in the same place, but at the end of the day, so much could have been saved, including their kidneys and a lot of money. So I don't know. I mean, I guess it's obviously hugely important, or else I wouldn't be doing it. But yeah, so connecting. And so the other part, I guess, I grew up cooking. That's what I did. And I actually was a pastry chef before I was a dietitian. So I love food. And I always tried to find a way of managing like food and nutrition and what I wanted to do for that. And so the GroceryRx program was that culmination of like, how can I bring these two together? And the other part that I really always try to focus on with patients is it's not just as simple as like, eat this like lower sugar or lower carbohydrate. It's obviously the quality of what you're getting, and also the freshness, and why these people that are the sickest people don't deserve the most nutrient dense foods, right? And so it's a huge part of what we talk about. And then also the why, right? So you can also tell people that are on dialysis and their blood sugar's out of their whatever, that they need to do this and they need to do this, and they don't. And we're like, what is going on? You're killing yourself. Why are you not doing it? So that why is equally as important. And that's where my other love comes in, where it's really focusing on, kind of the story behind food, the story behind their own food culture and how their parents did it, and connecting to that and moving it, along to where they can actually make changes with it. It's impacting their health. So that's, a huge, huge emphasis that we talk about too. So in the class, we do like food demos and tastings and stuff like that, because I want it to be more about more than just don't eat this and eat this. It's a lot more complex than that. So
I think, that goes with even just regular like medication therapy too, because the whole why, like metformin is the one I run into almost daily. Is like people like, I don't want metformin. It made me had diarrhea one time, and I'm never taking it again. And then so when I explain like why I'm bringing that up, because when I first bring it up, they like want to shoot me, and then I actually take the time to explain the why behind it, and that makes like all the difference. Like they'll like immediately want to go back on it. Like I feel like that's a big missing piece in medicine in general, is that why. We were in this habit of like, I got a white coat on, yo, you need to listen to me. Right. And then and I tell patients, I'm like, I wouldn't listen to some dude in a white coat. Like,
that's why you don't wear a white coat.
That's why I don't wear a white coat. And I'm super honest about that. I'm like, I want you to research this. I want you to like, I'm telling you the why, because I want you to be aware of what I'm asking you to put in your body. I'm not just telling you this because I think I'm awesome. And I think that's a really big part.
Yeah. And that's something silly that I say all the time, because I swear, as ridiculous as it sounds, and this is why dietitians are probably not given, I don't know, I'll stop there. But is I have the conversation with people every day to eat more fruits and vegetables. And I literally say to them, I know you've been told this since you were a kid, right? But just because you're told that doesn't mean that it happens. And I really do feel at this point I could write a book on why to eat your fruits and vegetables for health reasons, down to the microbiome and the blood sugar control and the fiber, all of this stuff. And I do take that time to explain why. And I really am a huge advocate as far as education goes, to make the information accessible to people, but never speaking down to them or thinking that they can't handle what you're about to give them. And so I always like to give people the why and the pathophysiology of what's going on, and tell them that. And then it's their body. They can understand it. They can know. And so, that why is huge.
When we were talking about the class, and you mentioned there was supposed to be a 6-week program that you graduated from. Obviously, we won't say names, but we have one patient that I think we both know who we're talking about. It's like my favorite person on earth. And no one gave her that memo. So like, literally she went to classes for like about 6 months. And and right before COVID came around, we had to put the classes on hold. She made an announcement to everyone in the class. So she's like, don't worry, everyone. She's like, I have actually, because she takes this poor lady takes the Medicare bus to the clinic to come to class. It was her favorite. You can tell it's her favorite part of the week. And she goes, don't worry, everyone, I have reserved the Medicare bus for the next 3 months, so I am good. And I was like, Olivia, I'm not telling her. There's no chance I'm telling her that she's not supposed to be here
She
anymore.
gets the first house visit.
Yeah. She does, yeah. Sure. And so she calls me now, and she's like, when are we starting the class? I'm like, whenever I'm not going to put a bunch of immunocompromised older individuals in a small room.
I think it's a testament to Olivia too, and the authenticity that she brings, and it's very. it's different, right? Like I've seen these kinds of classes before in person elsewhere, and it can be sterile, right? And it can be very black and white and by the book, and it can be like that kind of white coat feeling that you're talking about. But with Olivia, and that's kind of our whole thing with Lowcountry Street Grocery, is passion for food and passion for knowledge of food and the love of food and the love of community, right? And like, it's a buzzword. I'm so tired of saying community, and it's mainly because it's become this buzzword, and we're trying to like twist it around. The same thing goes with like, food is medicine, right? And it's like, this is like activating that. It's not just a t-shirt slogan or whatever. It's like, this is the real life thing. Yeah. It is, and it should be. But yeah, I think your classes, it's pretty remarkable that it fills up and people keep coming back. And I mean, the cultural relativity there, the food is there, the all of the pieces are there, and it's all real, right? It's not, yeah.
And it's cool too, because like, I think it is, I mean, for most people that I've talked to about it, like people have asked me questions about things like from the podcast and things. I think I've briefly mentioned it and stuff before, but everybody I've talked to about it is always like, oh, that's like a crazy cool program that you guys are doing, especially when I talk about like the mobile farmers market coming in and like setting up shop in the lobby. Yeah. And like you said, like the $20 voucher that goes a long way. I mean, most of our employees now take advantage of that. And so they'll be leaving like clocking out with 2 or 3 bags of produce and heading out the door.
Yeah.
So it's really, really cool. And I feel like I already know the answer to this, but from Lindsey, from a business standpoint, because there's passion, there's obviously the want to like help the community and stuff, which is awesome and always should be the foundation. But you have to, when you're dealing with businesses, there's always going to be that profit talk. Mm-hmm. So how do you kind of like tote the line with that, or how has that been the most frustrating part about a lot of this?
Yes and no. I mean, you kind of. Yeah. So you have this like foundational business approach, right? And everybody's got these models and numbers that you're supposed to adhere to. And it never really makes any sense. And you keep moving like the puzzle pieces around until it makes sense. And I'm like, man, I know this can work. I know that there's a point here where it works. And we're just constantly trying to prove it with one segment of the model, and the break even line just kind of moves with you. And as you pivot and you try, it's not frustrating if you're okay to let go. Right. Mm-hmm. So like, I just let go. I was like, all right, I'm just going to do this thing. And like, I'm literally just selling my clothes and like flipping my house downtown, like doing Airbnb. Ridiculous. I mean, it was absurd. Not going to lie. I definitely spent a lot of nights on the couch. I put a couch in our office so that I could spend the night there. Don't tell anybody. Oh yeah.
Well, let's stay between us.
Let's say barely anybody's going to hear this.
Thank you. Don't say
definitely not thousands.
Definitely not.
Yeah. I mean, that's the thing is like, all right, quit my job, go back into the restaurant world, right? Like work at night, go straight to the office, pound it out, crunch numbers, do whatever, put together a stupid marketing plan for a business. It's like all of these stupid classes we're taking and all that, just different advice. It was an experience I wouldn't change for the world, but yeah, I mean, I was up till 3, sleeping there, getting up, doing the same thing the next day until it works. So frustrating. Yeah, it was tough, definitely. But I wouldn't change it.
Yeah.
There's never a question as to continuing.
But once you get it, once and you're like, I can see it. I know it's going to happen in 5 years. I hope, fingers crossed. And you make the plunge, there's no turning back. But yeah,
I think it's because I know that the big question, anything I've ever talked about with work is like always like, well, how are we going to make money with this? I'm like, well, I mean, that'll come, but like, can we just, and it immediately has to justify it because
that's one thing you've been good at is justifying how to, bring income through, like say pharmacists or some other avenue.
Yeah. I mean, like if you started to say that about dietitians, I knew you were going with that. Try telling a clinic, hey, you should pay me this amount of money to come in and I can't bill for services because I'm not a real doctor.
Right.
And then they're like, are you out of your mind? Right. No. And then so like, I feel like it's kind of been a lot of that same kind of thing of like proof of concept. Yeah, and it's very frustrating at times. I know, because it's like I feel like I can see so clearly like it takes like a while and then after it's all said and done, then everybody's like, oh yeah, we were there the whole time. We saw it. Like, wait a minute.
Yeah, right. Seriously.
1 second.
But no, I think that's cool, and like especially now that and obviously you guys are doing all kinds of stuff on your own things, but like with the when we do the class together and stuff, not only is that, bringing in patients that are helping our like quality numbers, because those are our patients, and improving like their overall health because of getting that education. They're getting access to the good, fruits and vegetables and all this good food. And then from a business standpoint on top of that, because we like to use our in-house pharmacy and stuff. So then when I'm in there, like I can see the patient charts and like I can update their medications to be more evidence-based, which means potentially more reimbursement from like Medicare to the pharmacy, plus the patient gets better medication, and like it's like everybody wins, except maybe the insurance company. But that's fine.
They've been winning for a long time.
And even then
they have, but they win because
they don't
the
have to
patient is
pay for the
healthier, and so they pay for less.
So they win too.
That's
there you go. Sorry, Humana.
Which they now realize, and they're coming out. So we were like, do we say anything about this idea? And now they're coming out of the woodwork like, you guys interested in billing Medicare and Medicaid?
Right.
Yes.
So like,
please.
hey, we've got this really good idea. It's called preventative medicine or preventative care. Have you heard of this?
Well, I mean, you think same with like, like another thing I think about is like the Hep C medications. Everybody's like, well, why would an insurance, you have to try to convince an insurance company to pay $70,000 to cure someone's hepatitis C. I'm like, that's a lot cheaper than a new liver.
It is.
So that should be a no-brainer from a business standpoint.
There's always a hustle.
It's it's a long picture. And that's what, honestly, obviously preventative medicine is everything that I do. And so from that picture, that's why dietitians, right? So dietitians are covered, very, very little is covered as insurance companies for dietitians. We're fighting right now to be able to get covered for like cardiovascular disease. So right now, obesity and diabetes and renal disease, once it's to the point of terrible consequences, is the only thing that's covered. And to me, so that's a big fighting point. But like you were saying with the GroceryRx program, I mean, because we are getting these patients in more frequently, we can pull a physician in and they can do like an on-the-spot appointment and bill for that, and you can. And so there's also, we're seeing like better A1C control and blood pressures, and I do think that that's a combination, obviously, of the diet, of the access, and the fact that you were there as a pharmacist to tweak anything. If something's out of whack, or if someone says, I've been having a lot of hypoglycemic episodes recently or whatever, and you're sitting in class, it's like a little light bulb goes off, and you can be there to help that immediately. And so the payoff is just, in my eyes, is so obvious. Yeah. But I see, if you're not there, if you're not the one in that room, you're not the one living it, it's not that way.
Yeah. I think, unfortunately, a lot of people, not just clinicians and stuff, but a lot of people have a hard, especially finance guys. Finance guys have a hard time with this. Seeing like the potential in the big picture and like the long approach. They always, it's just like want to get to the next quarter and the next quarter. What are the and it's like, man, it's not about like lose some money in the short term to win the game.
Just like the markets.
Yeah,
it's the same thing. Everybody's so reactive. Everybody wants that tangible evidence right then and there. It's like, dude, just wait. It's just not, man.
Especially with medicine,
way down the road. Yeah.
Yeah, everyone wants to know what the profit margin is right now. I'm like, do you want profit right now, or do you want like to get the patient to like better and then have ultimately way more profit for that? I mean, the patient being better results in more profit.
Right,
like, that's just the way it is. Like,
and we're dealing with people here. Yeah, it's not that predictable.
Are we getting into politics?
Well,
no. Like we never. I don't even feel like that's. I feel like regardless of whether you're left or right on the issue, that's a hard that's a hard one to argue against. I feel like, but anyways, yeah, we won't get political on it, but it's all good. I think it's interesting too, because you mentioned that about the education piece. With all the stuff going on and with COVID and stuff in the news and everything like that, you almost from any source, like medical maybe, but like for the majority of anything you hear the debates about, does hydroxychloroquine work? Does a mask work? No one ever has been like, hey, how about we like start as a community like losing weight, getting our diabetes under control.
Well, it's not talked about often. One of the biggest risk factors is obesity. Is that where you're going for that?
Yes.
Did I just steal your thunder?
No.
Okay.
He was really building up to something
I know,
there.
and I just snipped it right off the top.
Unbelievable. Lindsay, take over. I'm going home. I'm going home to my downstairs. No, but it's just weird to me that nobody ever mentions that. Like, that's like, oh, we don't want to encourage people to get healthy because that might offend somebody.
Right, exactly. And that's what at some point in time, there's a huge taboo now about talking to people about weight and how, or about like their health. And that's something here too, you know, in the Charleston area, in the Lowcountry in general, it's a big cultural thing that families, and you all, I'm sure, realize it whenever you're talking to patients, families don't talk to their kids or their other family members about chronic disease. So like, I have so many people that come to me and they're like, yeah, I was just diagnosed with diabetes. I'm like, well, is it familiar? Like, do you have anyone in your family? They're like, maybe my aunt, maybe my mom. I'm like, do you ever talk about it? Have they taught you anything? Blah, blah, blah. It's always no, right? And so there's a cultural, but also just a stereotype with talking about it and being open about it. And now we're dealing, I mean, it's insane. The prevalence is insane, and it should be something that we talk about very openly and frequently. And so, yeah, I mean, right. So during this, I mean, everyone's looking for that quick fix, of course,
as usual,
per usual. I had someone come and sell me vitamins at my front door the other day. And she asked, she was like, can I interest you in anything? I said, no, I'm good. She said, really? You're not taking any like extra vitamins during
so you
this
hate
time?
your health?
Yeah. I'm like, all I could say was I eat pretty well. And then to her, that was like not sufficient.
Don't even. You should. Good thing you didn't bring up essential oils, or you'd been really. You'd have been in a lot of trouble. That cures COVID and instantly, and you weren't going to use it.
Exactly.
No, that's funny. The whole vitamin thing. I'm like, hey, man, you know what would be way cheaper than just buying all these supplements? Just eat healthy.
Just eat
I'm like,
something.
you know that the food has vitamins in it, right?
I know. And that's like,
But they're like, if we take the vitamins and we can eat burgers and
We don't
fries.
have
Yeah,
to.
that's true. That's a good point.
I know.
But you know what else too? I think we're skimming over is the fact that a lot of people don't have access to that, and the security point too, right? So a lot of
Right.
people
Yeah.
don't. Honestly, it's not always about like the price of the produce or whatever. I mean, it's just not the access and the security there. Like if it's not readily available and you don't have a bunch of money right then and there, and or the place that you're stopping at doesn't accept SNAP benefits, right? I mean.
Or
That's-
if you're afraid that you won't like something, you're not going to buy it.
Right.
You're not, or if you're afraid it's not going to last,
That's the
you're
other
just
one. It
not
doesn't
going to
travel.
buy it.
I mean, there's so many ways, and there's just so many parts of it.
It's
that
not an easy thing.
It's not, and like we can unpack it forever, but like we've just realized so much more. After being in it for so long with folks and like understanding, like, man, there's so many barriers that you just might not think about, till you're there. It's tough.
Yeah.
Anyways.
So what's the plan going forward? I don't know how much I'm even allowed to say about like the grant and stuff like that. I didn't ask, but I'll mention it real quick. Because of the group, like the class that we were doing and kind of like that collaboration, we had an insurance company drop a nice sweet grant that was going to allow us to do further the program and let Lowcountry Street Grocery do a lot of cool stuff and us as well. And so like it's now we're able to justify it to finance. Now we can rock and roll and like get going if this whole pesky pandemic would stop.
Right.
But I think that's the other thing that's pretty cool too is like now that we finally got some financial backing and stuff like that, it's like now we can like start really good, and then that's when we can open like the floodgates to like let where else can we go with it, and
Exactly.
I'm super excited to get that underway.
It's a big deal, and that's been the missing piece, right? That's been the missing component to getting Olivia everything that she needs that hit the ground running right now. I mean, everything that you've seen before is on your that's extracurricular 1 day a week kind of like after all of the other things you're doing. But this is really it, Let's go time.
And it's kind of, I mean, what I'm excited about with this grant is it's, we almost needed that proof to show that it's worth it's worth that financially. It's worth that attention. And it is. And I mean, I think getting the whole clinic, like I said, there's so many places around the country that have built this into their system. And getting that, I mean, Fetter could be the first healthcare clinic definitely in the Charleston area and in South Carolina to actually like get this fully integrated into it. And I just think that there's no excuse not to, it makes too much sense. So it's really exciting. And I'm trying to figure out now, because of the pandemic and how we're going to move this forward, hopefully sooner rather than later. Like I said, we have folks calling and asking when we're going to start class again. So I'm really wanting to get it even virtually, everyone's moving that way. And I think it could be pretty simple. It'd be just a lot of training for some of our participants. But it's totally possible, and it's going to happen one way or another. We're already, so I should mention this too, is since the beginning of the pandemic, we put the classes on hold. But the folks that were in our class, we've been delivering groceries to them since then. So they've been getting weekly or biweekly groceries from us as part of our grocery delivery program. And we do put a portion of, our energy every week into donations around Charleston. So fed the patients that we had there, and then also to others that have just been referred to us. So usually donations are not part of our scheme, but also a pandemic is not usually a part of it either. So we've continued the access part. That part's easy. Now it's the education, the community building. And I would argue, too, that our sweet patient that we were talking about earlier, I would say that the reason that she kept coming, I would say 95% of the reason is to see everyone. Mm-hmm. And so that's why that stupid word community that actually holds a lot is really, really meaningful, because without that, that's why people will stick with the same doctor for 30 years or whatever, the same clinic or whatever it might be, is because of the personal connection. And so without that, it's nothing. I mean, literally nothing. People will not come back. And so that building that rapport, that feeling is equally as important to me as actually giving the education. So hopefully trying to build that feels into whatever virtual platform that we do, which I have some ideas.
We're already set up for it with everything. We're so nimble as a mobile business. We have the buses and now delivery, and we're already kind of working out some logistics for in-home care and things. So, and we've obviously done the miniature markets right in front of the pharmacy, which no offense, dude. Sorry. We're kind of like, it's like competition.
I don't work a little bit. I don't work in there.
All right, fine.
He's not.
I'm in the class with you guys.
He's taking blood pressure.
We were like taking videos one day, like, oh my God, we got the farmer's market literally in front of the prescription window. And we're like getting videos of like,
but see,
this
and
is
that's
so cool.
But that's the thing. Like, I feel like that's the way it should be. Like, that's the emphasis shouldn't always just be on, and I'm coming from a pharmacist. Like, I obviously love some of the, not all the medications we have, but a lot of the medications that can be life-saving. Mm-hmm. But that whole conversation about food is super important. Every guideline now from like the American Heart Association, every single one is diet and lifestyle changes first thing before they even mention the first medication. Yeah. And it's medications can be a tool. I say this 800,000 times a week, but I'm like, medication's a tool. That's what I use it for. My goal for you would be get off medication if possible. Right. Like my type 2 diabetics that have, their A1C is not out of control. Like that's a possibility. We took someone off of medication this week whose A1C was a 13 when we first saw him. That was a 5, and he's completely off medication at this point. And so he got radical changes about his diet and exercise, and doesn't need medicine anymore. And so it's like, I think these two things should be completely, they shouldn't even be seen as like, we're trying to take away, they're trying to sell people on all this natural stuff. I'm like, no, it's food. We got
the bunny ears.
Which is, a mindset of some medical people and providers who might not be referring to. So say we're talking to providers. So for a provider who wants to refer or is considering or hasn't done it before referring to a dietitian and just hasn't prioritized it for their patients, what is it going to look like, at least for you or in general, and why would they want to do that?
You mean when that referral actually
when it comes through and the patient comes to your class, like where do you start with them, as far as depending on what disease state they have? So
class versus like one-on-one is different, right? So, but regardless, I have a lot of people ask me, well, what do we do here? Like, what is this? What are we going to do? And I'm like, and it sounds so stupid coming out of my mouth, but I'm like, we're going to talk about what you eat and how you live and how that affects you.
Then I come in with this piece of produce.
Right, exactly.
I got this honey nut squash for everybody
cool thing to show everyone.
Farmer Lindsey comes
Yeah.
in.
He does use that weird accent, which is strange.
Why do I do that?
Right when he walks through the door.
Wearing a straw hat.
Hey, everyone. We call him Farmer Lindsey.
A bunch of turnips hanging out of the back of my pocket.
Seriously.
Really sells it, though. So
Yeah,
that's
I can fix
great.
I know.
This is why food hasn't worked for so long.
I
That's
know.
it. That's the
because we
reason,
don't
right.
have our little
Because
comic
it's
Lindsey.
Farmer
coming
Lindsey
in.
walking around freaking everybody out.
Oh, yeah.
That's why.
Yeah. So when they actually are interested in the program, basically we get them set up if they haven't seen their primary care doctor or just in a while, then we get them set up with an appointment to kind of just touch base, see where they are, hopefully figure out what they're taking, if anything, labs. Right. And then they just start coming to class, and it's really as simple as that. And so the idea was to start with we're going to do 8 weeks, and then we're going to wrap that up, and they're going to be graduated and then move on. We didn't do that. We left it more flexible. So it was more of an open enrollment, which is interesting, kind of picking up with people halfway through talking about not being able to cover the basics. But at the end of the day, it kind of all works out. Mm-hmm. And whatever even if they're, and I always say this because we don't have everyone stick with it, definitely not the whole time, and I'm up for people just dropping in and seeing if they like it. Whatever nugget of information they go away with that day is wonderful, and maybe it's just not in the cards, or maybe they physically can't get there every week, and that's understandable too. So the ideal is to have people stick with it, and we emphasize that heavily. But if it's I'll take what I can get, right? So.
Well, we had, just even to that point, I don't even know if you remember this, but we had a patient that's only been was only at the class one time, and you actually started talking to her at first, I believe, because the patient was just seemed off about something, seemed sad, and so we started talking to her more, and the more we kind of got talking to her, you could tell something was really wrong, from something, she was very distressed, and so we ended up, I talked to her a little bit myself, and then even though the clinic was shutting down, me and one of the PAs that I work with pulled her into a room and actually had a discussion with her, and she was dealing with a lot of heavy stuff that I was not expecting her to kind of spill. And we ended up getting her started on a medication and got her referred to counseling and behavioral health to see a psychiatrist, and all that took place. So she goes, back to she as a patient in the clinic, even though she didn't come back to the nutrition class, but she could have potentially,
right.
She was potentially suicidal at that point. And if that, that's an example of something that you can't put on paper, you can't predict, you can't say oh, this is our business model, we're going to try to catch everyone who's having at their breaking point.
Right.
But I feel like these types of programs that open up so many different opportunities that
There's a lot of added care there as well. Yeah.
And that's probably, I think of it, whether it be on my one-on-one or in the class, you cannot separate emotional and behavioral health from food and from eating and from health. And so I address it every single time I talk with someone. And it's because otherwise it means nothing. They're not going to come back. They're not going to care for themselves. That why is not there, right? And so it's extraordinarily important. It's worth the time. And you're right. So she came that one time, but hopefully we were able to have a huge impact just because she walked in. And so that's my goal.
Yeah. So let's, for the healthcare professionals listening, can we talk through a couple just tips and tricks a little bit in case they don't have a dietitian that they can refer to, and kind of give some ideas of what we should be counseling on, especially if it's a time crunch situation. Just some basic things diabetes is the patient population that I talk about a lot, obviously, in here because that's what I deal with every day. But let's start with diabetes. Is there if you're talking to someone about their carb intake or anything, what are kind of some of the big sticking points that providers should know if they need to have a discussion with a patient? Because I think the one I hear a lot from providers that is not true is stop eating fruits because of sugar. They say you can never have things like rice, you can never have things like potatoes. And I'm this is South Carolina. We eat rice with everything.
That's not going to happen.
I heard a Hispanic patient was told she could not have tortillas ever again.
Right.
And I'm oh my gosh.
God.
Are you kidding me? You told that. And so there's a lot of misconceptions, because we had, like, as pharmacists, we have almost no training other than like parenteral nutrition. I mean, we don't get any other real training on, like,
Maybe one lecture.
maybe a lecture out of 4 years.
Yeah.
So, like, can you share some of that?
Yeah. So to sum it up quickly is hard. And that's usually, I always say that's why dietitians exist, is so that can be shuffled off, because it is a big conversation, right? It's a lot. And I always think that, like, physicians are really shocked whenever I say, like, my appointments with people are 45 minutes long, right? And so they're like, oh my God, we see people every 10 minutes or whatever. I'm like, yeah, but I'm trying to, like, make serious changes to their behavior, right? So it's pretty intense. So to make it quick is tough. But I would say, first and foremost, is that cultural relevance. So you were saying, you can't tell someone that they can't ever have this again, or they can't ever have that again, especially if it truly does, like, reach deep to their core, because it's going to affect them on a whole nother level. And that disease then is going to represent far more to them than just the disease, right? It's taking away a lot of their lifestyle and their identity. So you have to be aware of that. The thing that kills me is not eating fruit anymore. Because at the end of the day, what we do know is if we could get pretty much any patient with a chronic disease, whether it be diabetes, renal disease, cardiovascular disease, any of the above, more towards a plant-based diet, which heavily leans on fruits and vegetables, including starchy vegetables, we would be taking care of a lot of the health concerns that we have. And so my first thing with people, I do always have the fruit and vegetable conversation. I tell people I want them to eat at least 2 servings of fruit and at least 3 servings of non-starchy vegetables. And so that's kind of the goal. One of my primary things is what to always add into someone's day instead of taking it out, because all that they ever hear is stop doing this and don't do this and you can't have this. And as soon as you do that, again, you're deflating them and you're taking away that empowering feeling that they actually can have some control over this. So it's always what to add in. If they are hooked on sugary drinks and they don't like water, which I hear every single day, that is the first and foremost place that I start, obviously, because of just the zero nutritive content of it. So sugar substitutes always comes up as a big question mark. And it totally depends on the patient. But I would also start there. If I had 5 minutes with somebody, that's what I would talk about. Single-handedly is getting the sweet drinks out, because it makes such a huge impact. And something that is really impactful is, like, I'll show them if they do drink, like, 3 cans of Coke every day. And they're like, yeah, but I'm down from 6. I'm like, that's great, whatever. Those 3 cans of Coke still have 180 grams of added sugars in the day. And for our whole day, we want to stick to less than 20 grams of added sugar for someone that doesn't have diabetes. That's for the general public. So that is a good place to start visually showing them that. If they can't get off of sugar sweetened drinks immediately, I do say it's okay to move to the sugar substitute, so the diet or the sugar-free drinks, but not to plan on that long term, because we know that it does increase inflammation and it can affect your blood sugar that way. And it also is, 300 times sweeter than sugar. So their taste buds are going to be totally thrown off by that, right? And they're never going to taste a tomato and say that it's sweet, right? When really it is. It's got that sweet flavor to it. So trying to get them more and more towards just plain water. And that's also, it's kind of like a calibration of their taste buds, which at the end of the day will serve them really well. We also know that people that are obese don't taste things as acutely as people who are not. So they need stronger flavors. They need more sweet, more sugar, more salt. And I tell them that, I tell them what is going on in your body, why you're craving this. You're not unique. You're not like some sort of mystery. It makes sense. So just saying that, making them aware of it, and telling them that we're going to retrain their taste buds, basically, and it's going to take time. As far as like carbohydrate intake goes, I always do like 45 to 50% of their diet as carbohydrate. Especially, it's always that fine balance of not feeding insulin if they are on it. But educating them that carbohydrate is not all created equal. It's all very different. And including it is extremely important in managing their diet long term. And so, from there, fiber, we talk about fiber.
Yeah.
All the time. Digestive systems.
One of the things I feel like that comes up a lot, I guess, from my patients too, is they'll, in their mind, like for example, orange juice is very healthy. So then like having the, like, how do you explain the difference to someone between like eating an orange versus the orange juice, and like why one is significantly better than the other?
Yeah. And so that is, that's often a conversation, or they'll ask whatever kind of juice, they love, and they're like, well, it has this many vitamins or minerals. So of course that's when we have the fiber talk, right? And so the idea is that I say that, that liquid doesn't fill you up. It zips right through your system, and that's as quickly as it's going to affect your blood sugar as well. So I say, we need that fiber. It helps us to stay full. There's also that synergistic effect with food that you cannot get through supplements or other like additives that you put in. So I had a perfect example of someone last week who he has been quote unquote dieting for 30 years, and he's on the Atkins diet again, quote unquote, because he eats an Atkins bar every day. But other than that, he's still living Taco Bell at night and all of this and that.
Nice.
Taco Bell's Atkins, right?
Right. And he's intermittent fasting on top of that.
Oh, geez. So he read all of Men's Health.
Everything. But he's been trying everything. So he doesn't eat fruit because of the obvious reason. It raises his blood sugar.
Mr. Atkins said he can.
Exactly. And he doesn't like vegetables. And so he takes a probiotic and he takes a multivitamin and he takes a bunch of other stuff, right? So I tried to just drive that point home. Eat real food, right? There's nothing that can replace that. And he said, okay, so I'll have a can of green beans every day. And I'm hearing you say I can eat about 5 bananas. And I was like, not at all what I said.
I never once said a number.
I never once threw a number out there. But I mean, the point that I have, the conversation I have with a lot of people is eating whole food, recognizing where it came from. You cannot replace it with supplements. Yeah, I don't know.
And I think and tell me if I'm wrong about this, but the example I always talk about too with patients is like, okay, if you think about it, even from the simplest forms of your body needs sugar.
Yeah.
And so when you talk about like your insulin and all that stuff, when you eat orange, like your body takes a while to break that down because of the fiber from the actual fruit and all that, and break it down to get that sugar out. So you got this kind of like rolling sugar, hill. And whereas if you get the orange juice, there is nothing for your body to break down. Your body's like, cool, send that right through.
Right.
And then your sugar spikes, and then it's instantly up. That's just why I always say, this is why we tell you to drink orange juice if your sugar's low, because we want to fix the problem right away. That's why we tell you that, because it works very quickly to get your sugar up. And I feel like that little like correlation between like the fruit versus the fruit juice is like something that they've never even thought about before. Right. And I mean, it's something that I always try to bring up with my patients too. And then I've heard as well that, and correct me if I'm wrong, but I've heard that if you're having, because a lot of my patients for breakfast, for instance, it's just nothing but carbs. It's freaking Raisin Bran. It's 2 pieces of toast and a glass of orange juice and then a fruit on top, And then you're like, okay, let's talk about adding protein to that. Right. And so if you're adding protein to a carb, it's important because, again, that kind of adds to how quickly your body's breaking down those carbs and turning it into glucose internally. Is that pretty accurate?
Correct. Yeah. So I always, that's Mike knows his
Nailed it.
My other like buzzword phrase that I get tired of saying a million times a day is always pairing a protein with a produce. And it's my rule of thumb of making sure that they get enough produce in during the day, so fruit or vegetable, and that protein to help slow that blood sugar and to keep them more satiated and full and feeling a variety, right? So when it comes to, I should back up and say that no matter what disease it comes to, I mean, often if someone is coming in with diabetes, they also have hypertension and hyperlipidemia and a number of other things. The surefire way of improving all of those is losing weight if it's applicable, right? So then I'm like, we're not going to talk about carbs. We're not going to talk about sodium. We're going to talk about how to lose weight, and it's going to fall into place. And so then that becomes my primary focus. So I'm not even, unless their A1C is 14 and they're chugging a bunch of like soda or something, I'm not really talking about like the carb and sugar game. I'm more focused on weight loss and exercise, which is, again, because I have I always say, like, everyone wants something to help them lose weight and feel better and sleep better and go to the bathroom regularly and bring their blood sugar down and their blood pressure. And literally the only thing that can do all of those things is exercise. And so whether it be, I mean, they can't move or, they're immobile, they're bedbound, whatever. Well, I don't really work with that many bedbound people, but, they just really can't move or they have significant pain. I encourage activity however they can do it. And so I push people a lot on that. Within bounds and within safety, but that is one of the first things that I always talk about. And then I bring in blood sugar control, of course, and how necessary it is for managing your glucose.
The Atkins diet and any form of that, keto, whatever you want to call it, like there's all kinds of names now. Atkins got to be upset about that. He's got to be mad. People are stealing his idea like crazy. But that's super popular, like what people talk about. So I get questions about that as well. Like, well, if I have diabetes, obviously the Atkins diet's perfect for me. And I'm like, no. So why is, like, for people listening, that since that's such a buzzword, why is that not an efficient long-term diet?
Right. Yeah. So particularly keto, right? And the difference with keto is you actually put your body in a state of ketosis, right? Which happens after restricting yourself to 40 grams or less of carbohydrate a day.
Which anytime you can go into metabolic stress in your body, that's great, right?
It's great. So you want to completely throw things upside down and make yourself feel terrible. So I always do, whenever someone brings up to me that they're playing around with the idea of keto, the first thing I say is that from a clinical standpoint, the only time we use keto is if someone has epilepsy. And it's because it can control seizures, right? And so that shows you how much it changes things metabolically, how altering it is for your system. And so the long-term effects of keto or Atkins is it's not sustainable. To never envision having a piece of fruit again or something, it's not realistic. Whatever, 3 months, maybe 6 months, maybe. But then when they start back, they will gain the weight back because they don't know how to control it from a nutritionally balanced standpoint. The other thing is that often people don't know what they're doing, and so they do it incorrectly, and they do like heavy like bacon and eggs and steaks and heavy protein, when really the keto diet's focused on fat intake and increasing at least 70% of your calories from fat. So they also aren't doing that. They're not doing it intelligently. Their cholesterol is going up. Their blood pressure is going up. They're having greater insulin resistance. So their diabetes is actually not improving. All of these things are happening, and then they're going to throw their body back out of whack, start eating carbohydrates, and gain weight again. And they're going to be right back at the same place. So the last thing that I would say about that is I've seen so many people with borderline eating disorders coming to me absolutely terrified of eating carbohydrates because they've seen their moms avoid them. They've seen their grandmas avoid carbohydrate, and they are terrified. And they say, if I eat a piece of bread, I just see the weight compounding on. I'm like, that's not true. It's probably what's on that bread or what type of bread, right?
Eat a piece of bread right now.
Let me see it happen.
I want to see it.
So, I mean, just a lot of like fallout.
Yeah. What about people skipping meals?
So that's the other thing, right? With the weight management part.
Because if I don't eat, I'm not going to gain weight.
Correct.
And my diabetes is going to be instantly better.
Gone. I'm going to lose a lot of weight. So I would say, and people call me on this all the time, but I would say about 70% of the people that I see that are morbidly obese eat 1 to 2 meals a day. Or 1 to 2 times a day. Mm-hmm. So they really don't snack. They just, and for a long time I was like, you're lying to me. I know you are. But then there's so many people saying it, and so innocently, and people that really wouldn't know better. The truth that we know now is that your metabolism obviously slows down, right? It's a safety mechanism that's built into us. So that is the other, like with the protein in the produce, is I tell people that I want them to eat something every 3 to 4 hours containing a protein in a produce. So it really is that you have to eat more in order to weigh less. And then we have to talk about quality and energy dense versus nutrient dense, and how you balance those foods. So and we do also know that people who eat less than 3 times a day, there's an inverse relationship with obesity. Mm-hmm. So that's, at this point, not even a question. Though so many people are shocked to find that out.
It's counterintuitive to like what you just expect.
Mm-hmm. Yeah. And that's where intermittent fasting comes into play too. And there actually are a lot of studies. They're obviously still working a lot on that, but there are a lot of studies about the benefits of insulin resistance and improvement in diabetes from intermittent fasting and weight loss. But there's also some care that has to be done within that. So if people come to me and they want to do intermittent fasting and it's working and they are losing weight and they like the lifestyle, that's perfectly fine. I tell them they still need to eat 4 times within that time frame.
Yeah, I think I would prefer the every 3 to 4 hour eating thing.
Correct.
I'm not a fasting kind of guy.
No.
The and if you skip a meal, and correct me if I'm wrong, but the way I've always thought about it too is if you skip a meal, for instance, your body's like, oh shoot, let me help person out real quick, and your liver's going to be breaking down some glycogen and releasing that into the blood. So from a diabetic standpoint, your blood sugar is going to potentially go up from not eating a meal. And so that's something that I feel like a lot of people are like completely blown away by, because they're like, I'm only eating 1 time a day, my sugar's getting worse, I don't understand. And then when you break that down to them, they're like, crap.
I know. And that's what I do. I mean, the simplest way of saying it is that our bodies are really smart and they are made to survive, and they will do what they need to do to survive, including those wonderful safety mechanisms like putting blood sugar back into your body to make you function. So it's just that simple. I mean, it's not revolutionary, you know, but it is that simple, like stepping back and saying your body's going to take care of you until it can't, until you abuse it to a point where it can't. But yeah, I mean, basically.
And I think one of the examples I always tell patients is I'm like, the reason why some of those like low carb diet things work initially, I'm like, your body needs carbs so bad to survive that it literally takes fat cells and converts them into sugar. Like the whole beta oxidation thing and all that. Like you're talking about a very complex biochemical process happening because your body just has to make sugar. Like it needs it that bad.
Right.
So this whole idea of like you can never have a fruit again, that's like what I use to combat the fruit argument. With I'm talking to a patient who's been told for a long time they can't have fruits ever again.
Right.
I'm like, your body needs sugar. Like you have to have it.
Right.
You just don't need to get it from blow pops and Pop-Tarts.
Right. And that is, I mean, before I dive into any education.
I know. That was what you
those are my go-to.
I was like, I think I saw some blow pops earlier.
I know.
I blow pop in 15 years.
This podcast sponsored by Monster and Blow Pops.
Shout out to Blow Pops and Charms. I think Charms is who makes Blow Pops. No, I love Blow Pops myself, and I'm not allowed to have them. And I can't.
Not allowed to have them. What do you?
Oh, I'm telling myself I'm not allowed to have them because they're horrible for you, and I'll eat the entire bag.
But they're probably like what, 3 grams of sugar? I mean, as far as
negative,
the things,
they're about 20 per pop.
No way.
Yeah, they're a ton.
That's surprising.
You gotta chew all that sugary gum.
Yeah. I looked at him and was like, and then Jim buys them for he's like, and I'm like, no, throw them away. You know that's my weakness.
What a random weakness.
Yeah, I know. It's super weird. I'm like
need to
6.
make like a healthy blow pop. That's what.
Yeah.
Oh gosh.
I bet they've got.
Hey, if you come up with the compound, we'll compound it for you.
I was gonna
Oh yeah, we can make them. Make candy.
Kohlrabi blow pop.
No. Bitter? Nobody's gonna eat that.
Bitter. Oh man.
Yeah.
We'll table it.
Yeah, we'll pin it. Put a pin in it.
But no, that's good. I think we need to do like another follow-up episode and just talk diet counseling points like for another hour. But so anything else you guys want to like add? I think we've been going for like over an hour now. So, but any other like last little bits you guys want to add in there?
I don't even know. I always feel like we leave so much out there. It's
Well,
been a long time.
The good thing is if we need to do a follow-up episode, we can just schedule it.
Now everyone hold your breath for another 6 months.
Yeah,
We will be back.
Another year and a half.
Lindsay's hard to pin down.
We'll drive the bus out here.
Yeah.
Ooh, that's
we should record
coming to you
from
live.
We
From the
could
bus.
have
We
a
could
market out
actually
here
do
in this
that.
neighborhood.
Oh,
They
yeah.
do a food truck thing on Friday. I don't know if they're not doing it right now. I don't think. But they do a food truck thing on Fridays.
Yeah.
For that.
by the park or
Yeah.
whatever.
And honestly, they're not the most healthy.
I believe that.
What neighborhood?
Carolina Bay.
Oh boy, that's the one.
That's the one.
That's our record breaker. That's the biggest market we've ever had.
That's where you're sitting in that neighborhood right
We
now.
had-
You didn't even know.
we
it.
didn't even know.
I kind of figured, and it was it was the food truck Friday. We had like 150 people waiting outside. It was dead summer, so hot. I had to go outside, almost died seriously a couple times.
That's where we almost lost them.
They hated us. They thought that was like status. They were like, "This is how it runs." It was like 150 people, 9 people on this bus, just standing still, just grabbing stuff. They're like, "This is cool, I guess," and just buying stuff, and then that was it. We were like, "This is not going to go over
This is
well."
not
People think
okay.
that this is how it works all the time. They hated it. They loved it and then they hated it.
That's fine. Believe me, I'll show you this neighborhood's Facebook page. They're gonna hate it regardless. My wife's car's been on it for speeding. Like,
It was hot on there.
They hate people in general.
Just anyone.
Oh my gosh! The second they have a chance to put you on blast, you will be on blast. It's a rough neighborhood to live in. It's tough out here in these suburbs. It's ruthless out here. But yeah, so if people want to contact you, where can they find you? Social media, email, anything like that?
So yeah, Lowcountry Street Grocery. That's, I guess, the mothership of all of this, and then community supported grocery. Facebook, Twitter, all that fun stuff for both. Probably going to start a GroceryRx page here soon, I guess. I think that's probably due.
Have to figure out the HIPAA thing, but other than that, we'll be bringing it sometime in the next few months.
Yeah, there's not really a lot of activity on our anything on Facebook or our website. We've been so busy just doing the things, and that's kind of something that came up today. We gotta get on the market.
Gotta get one of your 25 employees working the social meets.
If we could just,
you guys have like an endless supply of content you could be producing.
Yeah, if they get, maybe they could do that while they're delivery.
Well, let's you and I should take a trip over like Trident Tech, see if we can find some interns for like in the audio video department, and we'll be like, hey, you want experience filming for not only the business standpoint but also the medical standpoint, because we could use videographers.
We need some help,
and you're gonna do it for free.
Yeah,
and this is for your school.
Exactly, this is for your growth.
Yeah, for sure. We should definitely do that. Talk more. But so we'll definitely put y'all's handle and stuff for Instagram in the show notes and all that, and make sure people can find you guys. But Cole, you got anything else?
That's all I got, man.
So thank you all so much for listening. I hope you like that. If you have any questions, you can definitely reach us by email. You can find us on any of the social media platforms. If you want to text me directly, it's area code 415-943-6116. And definitely look forward to your questions. If you guys want to do another nutrition, dietitian type talk, definitely hit me up about that so I can start annoying Olivia with part 2. And we'll hopefully have them both back on and talk some more. But if you guys have anything, definitely reach out to us. Thank you guys so much for listening and following the podcast, the Instagram page. The Patreon has been doing awesome. I super appreciate everyone that's been supporting me with that. I hope the lectures and PowerPoints and all that stuff are helpful. And, if you guys have any ideas for topics or anything, definitely reach out to us as well. And, thank you guys so much for everything and for listening. Y'all have a good one. Bye.